How do you find SACT? Can you describe SACT in about 3 words?
3 words. Scientifically rich. I'm gonna use that as one word. Hmm. Very engaging. Um, Very informative. I've really enjoyed it.
All right. You have worked a lot with MSCs.
Yeah.
Gone through their applications, done a lot of work with them. I wanted to ask, what are the three hottest areas where MSCs will be um, incredibly useful in the coming decade?
Well, I think autoimmune disease is one of the areas that they're being tried in. Obviously, graft versus host disease, they were just improved. But I would say knee osteoarthritis is where my passion lies because it's a local injection. It's a low grade inflammatory disease. There's a huge unmet need. And if we can tackle the heterogeneity issue, I think we can really solve that problem. Then we can get MSCs to work. And they've already got a product out here in India that's been approved by the regulators, and hopefully it will be taken up and it'll be a commercial success. But that's proof that this product can work in a complex disease like knee osteoarthritis.
Right. What are applications of MSC specifically in cancer?
Yeah, that's been a little bit more contentious because of their immunosuppressive properties, right? But there are, and we just talked about it in the panel, MSCs that are modified with trail ligand or notch receptor, or HSV-TK that are being tried in various metastatic and non-metastatic carcinomas. And I think the jury's still out there. They're still in kind of phase 1, phase 2 trials. So we need to see if they're actually really reducing the tumor burden and continuing to reduce the tumor burden compared to other kind of indications. But it's, I think, their ability to deliver the payload that makes them very useful in those types of cancer applications.
Quite often when you work in the lab, you come across an issue which you hope someone else would have solved, a tool someone else would have developed, or problem someone else would have already addressed. Are there some projects like that that you wish you could have done, but someone else should have done it by this time? Some directions people could work on?
Well, there was this one, I showed some data where we, for example, we're tracking MSCs in a preclinical model, right? And I wanted to do this clinically because I think that we actually don't know what happens to MSCs once they're injected into a patient. But there was really no enthusiasm for funding that back then. But now we've come back full circle and everyone's like, we need to know what happens to MSCs when it's put into a patient. So I see that sometimes research is passed on and it's like, oh, it's too basic, it's not important. But then as the field progresses, you're like, no, actually, that was a really important and necessary question. We need to go back to that. So a little bit iterative. So hopefully that'll be solved. But I think you were asking more about a technology. Is that
Yes. What tools would you like to have that someone else would develop by now?
I mean, I think we have a lot of tools that are coming up with assays and readouts, right? Like single cell sequencing.
Sequencing.
Yeah. So I think we have a lot of tools. We just need to know how to use them and how to interpret the data that we're getting from them. One of the things we find, especially with single cell sequencing and other things, is we're getting lots and lots of data. But how do we correlate this? How do we interpret that? And how do we make sense of the data? Is I think where I'm struggling with trying to understand the clinical relevance or the potency relevance of having this kind of information.
Right. That's wonderful talking to you. Thank you, ma'am.
Thank you.